was because I was running this training program, or I should say organizing under the director. The more unusual cases were discussed at a meeting that we had weekly. And so somebody who was from San Francisco, who'd moved back to New Hampshire to be with his family when he was very ill and had multiple different complications, was discussed. And I just remember saying to myself, this is interesting, but I'll never see this again. I mean, it was like, it was so unusual at the time. And then fast forward next year, moved to Seattle, and boy, this is what I was studying. There was a public health clinic that was a joint project of the King County Health Department, that's what their old name was, and the University of Washington. And that was focused on sexually transmitted diseases, and because it became apparent that AIDS and subsequently HIV was sexually transmitted, that clinic became an appropriate place to study this entity. However, that wasn't a really good place to care for people with AIDS, because it was a walk-in clinic. It focused on gonorrhea and chlamydia and syphilis, and didn't really have a pharmacy. So a woman named Joan Kreis, who was a fellow at the same time I was, and I decided there should be a clinic set up at Harborview to care for people with HIV and AIDS. And that clinic was originally called the AIDS Clinic, and then when it moved away from Harborview, we decided that it wouldn't be a good idea to have AIDS Clinic on the door, and so we called it the Madison Clinic because it was near Madison, and that's the building that's across the street from here. I mean, I remember when the first reports of women with AIDS came out, and there were many people who said, oh, that can't possibly happen. This is a gay male disease. Women can't get it. But because of my background and training as an infectious disease person in sexually transmitted diseases, it was sort of, duh, of course they can. Our society is just so bizarre because people like to look at handsome and gorgeous men and women, and yet there's still such stigma about anything that gets transmitted by sex. I don't get why it doesn't make sense to me, but I fear that the stigma about having sex is pretty ingrained, and it's much better than it used to be, but there are still elements of our society that are quite conservative with respect to sex and talking about sex and believing it's something that people should learn about and how to protect themselves. So I think what started as a kernel of an institution with one small clinic and passionate researchers built on a foundation of academic excellence, really grew to a very large program. That's the Center for AIDS Research has many millions of dollars of support built on getting grants to answer questions about HIV, both across a broad spectrum. And so this city has really contributed a lot to improving the knowledge base, which then moves to improve the care and treatment of people with HIV around the country, around the world, actually. I remember feeling that it's too bad that we can't have access to these treatments around the world. And so it wasn't until 2000 that there was an AIDS conference in South Africa that really sort of sparked the world to make treatment available, to make the resources available to help treatment. That movement had probably been growing, but that particular conference really catalyzed that and led to a program called PEPFAR, the President's Emergency Program for Resources in HIV. And so it ended up catalyzing the US government to provide resources for care and treatment in resource-limited settings. One of the things about South Africa, the place the conference was, a quarter of the population had HIV. They didn't know it because they hadn't been tested, but the studies in that part of Africa, the town called Durban, was such that if you can imagine walking down the street and knowing that every fourth person that you see has HIV and is going to die if nothing happens. It was really just very catalyzing for people who are interested in trying to move health forward. There have been at least 2 and maybe a third individual who've been cured of HIV. The first 2 who were cured had cancers and received marrow transplantation, stem cell transplants, to treat their cancers. They would have died without those transplants. And the physicians who were taking care of them had a really bright idea, brilliant idea actually, to give them a marrow transplant or a stem cell transplant with cells that are resistant to HIV entering them. And that entity, the resistant cells, has been known about for a while. It's a genetic mutation that is relatively rare, but it prevents HIV from entering cells. So these 2 individuals, spaced in time, different positions, ended up getting given cells that were resistant to HIV. And lo and behold, it was shown that HIV disappeared from their bodies, and over many years, they didn't get HIV. People need to keep an open mind about HIV and stigma and try and help folks and support them no matter where they came from, how they got HIV. And somehow I'm not sure our society is always very good about that, but I think it's something that we all need to work together